equipped to deal with those cases. Now coming to the topic that I have picked up for today, I'll be sharing my clinical experiences in treating surgical cases. Now we look into the organ part, the classification of diseases. Hahnemann broadly, I put up a slide here. Hahnemann broadly classifies diseases into surgical and dynamic diseases. We'll go ahead, we'll go further. As I was trying to tell you, in a homeopath's life, we have various cases coming up. For example, we might have some surgical cases coming up from the respiratory. It can be from GI, it can be from the female genitalia, from the renal, from skin, from CNS, any part of our body, we might see surgical cases coming up. Okay. And in treating surgical cases, or in achieving our goal, our objective of treating surgical cases, we have to be very well equipped. What is the only requirement that we need is, one very important requirement we need is, we should have a sound knowledge. Knowledge plays a key role here. Now, what is that knowledge that one should have? I'm talking of homeopath. So you need to have a sound knowledge of homeopathy. When I say homeopathy here, I talk of those three very important subjects: organon of medicine. We also have the materia medica, the repertory. Having a sound knowledge of this will be very, very important. Now, not only homeopathy, we also have to be very well equipped with the allied science, knowledge of the allied science. Slowly you will understand, as we go into the presentation, you will understand why this becomes very, very important. So, what have I planned? I have been given some 90 minutes time. So what is it that I'll be trying to do the next 90 minutes? What are my objectives? What am I trying to give is what I'll try to tell you in a nutshell. I will talk to you about a case, a surgical case related to the respiratory tract. We'll also discuss one or two cases related to the GI, of course, the gynec, skin, and in the end, I'll conclude with some take-home message, some clinical tips for the beginners, and of course the practitioners who have come up. So this is what I have planned for today. Now, before I execute my plan, I would like to take the blessings of this great man, Dr. Hahnemann, the founder. Okay. I would also like to take the blessings and thank my guru, from whom I have learned a lot, and I owe him a lot. And whatever I am presenting today is based on what I have trained and what I have learned from Dr. Vijaykrishna sir. He is doing a tremendous job in motivating many homeopaths to practice the right homeopathy. Sir, seeking your divine blessings, and a lot of teachers have had a very great impact on my teaching career. I can't name all of them, and one person I would definitely like to name is my teacher, Dr. Munir Ahmad sir. And now this session wouldn't have been possible without the cooperation of all my patients. See, they have been very frank, and they have been very happy to share the videos. They have given me permission to share the reports. So a lot of gratitude to my patients for believing in me, and for also giving me permission to share the personal history, personal data, their visuals. Thank you to all my patients. And before I move further, I was told that today's webinar is being conducted by the Student Council of Alvas Homeopathic Medical College. It's a great feeling, you know, when you address a young and a vibrant crowd. Okay, so I hope our learning for next 90 minutes will be very fruitful, and I appreciate the fact that the Student Council, they have taken up this huge responsibility of conducting webinars and helping the youngsters to gain knowledge from the senior faculty. And I also like to welcome many doctors, my senior colleagues who have joined, the staff from Alvas College, and the predictive faculty, doctors, many other doctors, the PGs, the students of my own college, Government Homeopathic Medical College. A warm welcome to all of you for spending your valuable time. And I promise I will try giving the best. Okay. On this positive note, we will start with the presentation. Now, coming to the presentation that I am planning for today, how do we approach a surgical case? Now, when you talk of surgical cases, I have two very important things that comes to my mind. And whenever we talk of surgical cases, definitely the acute emergencies. For example, we have renal colic, we have acute appendicitis, those acute emergencies come into picture. And how do we tackle acute emergencies? Now, acute emergencies, we have a different methodology. We prescribe based on an acute totality. Today, I am not discussing about the acute cases because in the last webinar, I have already discussed about approach to acute cases. So interested participants can have a look at those videos which are available on YouTube. Now, my primary focus today will be on those diseases which are surgical and which are chronic and which are not life-threatening. So these are the cases that we generally get in our homeopathic clinic. So we will try to understand them, okay? And to make things very simple, to start with, chronic life-threatening cases, majority of the cases that I'll be discussing today, the approach is the constitutional approach, okay? So we will not waste our time. We will quickly take up few cases from my clinical practice. And in the first segment, I'll be focusing on the dermat. For many, dermatology is our favorite thing because they're not life-threatening, they're very safe. So we generally have a lot of dermat cases coming to our clinic. And I'll just start with few simple things. Like, for example, this was a case of facial wart. It is not molluscum, it is facial wart. And then we have a girl with molluscum contagious. You can see the images before treatment and after treatment. Not only molluscum contagious or warts, we also have a lot of cases, especially like we have cases related to skin. We have ulcers, non-healing ulcers, varicose ulcers, bed sores. They are beautiful scope in homeopathic, in our homeopathic system. This is a case, which I had shared in my RM presentation. I'll not repeat the same thing. We will have something new today, but this again can be seen on YouTube. Beautifully, this lady improved with 2 doses of RM met. Now, I'll start with a very simple case and slowly we'll take it further. Now, this is a case from what you see, okay? Now, before I go into the presentation, deep into the presentation, I'll not be taking up your questions while I'm presenting the case, okay? We'll definitely answer the questions towards the end because many times what happens, the flow gets interrupted and it will affect the presentation. We'll try making this interactive, this being an online platform. Okay, we'll see what best can be done and how interactive can we make this session is very important. Now, I was talking to you about this case. If you see this case, you can understand this is a case of viral warts. Okay, and plenty of watts. It's almost some 50 to 60 watts she had. You can just have look at the video. It's there all over. So I hope we'll skip this. Yeah, and this is the photograph that I have taken, and this is for your reference. So this is a case of viral wart. Okay. Now you need to understand, many times viral warts disappear on their own, and we homeopaths take credit. Okay. Now here, why this case becomes important here is, she started with few viral warts, and slowly the number increased, and in the follow-up video she will share with you that she suffered with this for almost 5 years. Okay, so it becomes a valid case, and we took up this case. Initially, I had prescribed some specific remedies. It's a very old case. So like, for example, specific means like I had given her natriumur because as a material teacher, I know natrium is a beautiful remedy acting on warts, especially the warts on the fingers. So few remedies were given, and unfortunately, none of those remedies gave the kind of relief I expected. When we started, it was on our right hand, and with the treatment, the warts progressed to our left hand, and it's a bad sign. Okay, so we took her case in detail. I felt we were missing something, and the case was taken in detail. Okay, so she's a lady aged around 30 years. She's been having warts for almost 5 years. The warts were gradually increasing in number. See, I will keep the case taking short so that we can squeeze in more cases. Our case taking, the predictive methodology, our case taking is very detailed and very elaborate. Okay, so I will go, or I'll just give you what is very important for us. So the number increased, and in the personal history, she had desires for radish and spicy things, chili patient. In short, about her life space investigation. Born and brought up in a small village, happy childhood. She was very good in studies. Wanted to pursue higher studies, but there was no support from the family, which happens with many of our Indian women. She got married for almost 8 years now. They stay in a village close to Shimoga, and as a child, she is very low on her confidence. Her younger sister, she told, is very smart. She mixes very easily, and I basically am very hesitant, and I have difficulty in taking decisions, and I can't give any stage performances. Even in school, singing, dancing, I was never into all those things. Not very comfortable. Lot of fear, and when I asked what exactly she is afraid of, she came up with 2 or 3 very important things. She was talking of reptiles in general, and when I asked her what exactly you mean by reptiles, or what exactly you are afraid of, she was talking of lizards, and more important, she was telling that she is very much scared about snakes. Okay, to the extent that even if some scene is coming on TV, some movie, some Nagin serial, some Nagin movies are coming, she would ask them to either switch off or change the channel. Even in the magazines, she could not visualize, or she could not see the image of snakes. Please listen to the presentation, make a note of the valid point. At the end of this case, we'll have a small discussion, and accordingly we can proceed further. When I ask you to contribute, I expect you to be ready so that we need not waste even a single minute. 90 minutes is what is allotted, and I'll try to give the best that I have learned, and you try to take the maximum that you can. Okay. So with this small understanding, we'll move further. So angry for small things, basically with close people and with strangers generally doesn't express her anger. So this is in short about her case. Don't ask me more questions about the case, but if you can give me a small analysis, what exactly you got in this case? What exactly you got in this case? Okay, yes, very good. Somebody says this person is a timid person, beautiful, good. She's lacking confidence, absolutely right, good. Yeah, any other inputs? Okay, she cannot decide. She's an introverted person, beautiful, timid, yielding child. She's got a lot of inhibitions. Okay, fear of reptiles, good, good. Yes, so at least, interaction should happen. Otherwise, it will become one way and it will be boring. Now, many of you, whatever you have given is what I have also taken. So what rubrics I took, this was in 2013, if I am right. I had taken confidence want of, that was my entry rubric. And that strong sense of fear of snakes, that was also taken into consideration. And one small thing many of you missed was warts. And if you try to understand this case, it was typically on her fingers. So I need a remedy which has warts on the fingers. Okay. So the repertorial totality leaves us with sulfur, lachesis, calcarea, natrimur, and laccan. I had already given natrimur, I told you. I also gave her sulfur, and the remedy that suited more. One more thing that you can also add here, I don't know if that's there in the chat, whatever you have tried to contribute. One more very important thing you can add here is desire spicy. So if you club all these things, one remedy stands out, and that remedy, I am happy that few of you have got the remedy also right, and the remedy is laccan. Okay, a very neglected remedy. Laccan has got a lot of things. I'll not go into the details of laccan. My topic is different, but laccan 200 single dose was given, and you will see what happened after laccan. Okay. She says, "Cons, don't worry. She's not a medical person." So I mean, you are not getting the audio. So 1 second, please hold on. I'll just 1 second, 1 second. Share screen. Share with computers. Okay, 1 second. I'll just get back. Okay, we'll come back to this case. Yes.
ಈ ಬೆರಳುಗಳೆಲ್ಲ ಕವರ್ ಆಗಿತ್ತು. ಬಲಗಡೆ ಈ 3 ಬೆರಳುಗಳು ಫುಲ್ ಕವರ್ ಆಗ್ಬಿಟ್ಟಿತ್ತು. ಎಡಗಡೆಯಲ್ಲಿ ಒಂದೊಂದಿತ್ತು ಅಲ್ಲೇ ಇಲ್ಲಿ. ಸುಮಾರು ಒಂದು 5 ವರ್ಷದವರೆಗೂ ಶಿವಮೊಗ್ಗದಲ್ಲೆಲ್ಲ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಂಡೆ, ವಾಸಿ ಆಗಲಿಲ್ಲ, ಎಲ್ಲೂ ಕ್ಯೂರ್ ಆಗಲಿಲ್ಲ. ನಂತರ ಬೆಂಗಳೂರಲ್ಲಿ ವಿದ್ಯಾರಣ್ಯಪುರಮಲ್ಲಿ ನಿಶಿತಾ ಹೋಮಿಯೋ ಕ್ಲಿನಿಕ್ ಅಲ್ಲಿ ಡಾಕ್ಟರ್ ವಿಜಯಕೃಷ್ಣ ಸರ್ ಹತ್ರ ಟ್ರೀಟ್ಮೆಂಟ್ ತೊಗೊಂಡೆ. ಸುಮಾರು 1 ವರ್ಷ ಅಲ್ಲಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತೊಗೊಂಡೆ. ಇವಾಗ ಆ ಕಾರ್ನೆಲ್ಲ ಹೋಗಿದೆ ನೋಡಿ, ಎಷ್ಟು ನೀಟಾಗಿ ಹೋಗಿದೆ. ತುಂಬ ಕೈಯಲ್ಲಿ ಫುಲ್ ಕವರ್ ಆಗಿಬಿಟ್ಟಿತ್ತು. ನನಗೆ ನನ್ನ ಕೈ ನೋಡ್ಕೊಳಕ್ಕೆ ಬೇಜಾರಾಗ್ತಿತ್ತು. ತುಂಬ ಜನ ಕೇಳ್ತಿದ್ರು ಏನಾಗಿದೆ ಅಂತ. ಅವಾಗ ಒಂಥರ ಅನ್ಸೋದು. ಇವಾಗೆಲ್ಲ ಕ್ಯೂರ್ ಆಗಿದೆ, ಈಗೇನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ, ಚೆನ್ನಾಗಾಗಿದೆ. ತುಂಬ ಜನ ತುಂಬಾ ಜನಕ್ಕೆ ಆ ಅಡ್ರೆಸ್ನ ಈ 3 ಬೆರಳುಗಳು ಫುಲ್ ಕವರ್ ಆಗ್ಬಿಟ್ಟಿತ್ತು. ಎಡಗಡೆ ಇವಾಗೆಲ್ಲ ಕ್ಯೂರ್ ಆಗಿದೆ, ಈಗೇನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ, ಚೆನ್ನಾಗಾಗಿದೆ. ತುಂಬಾ ಜನಕ್ಕೆ ಆ ಅಡ್ರೆಸ್ನ ಕೇಳಿ ತಗೊಂತಿದ್ದಾರೆ. ಈ ಕ್ರೆಡಿಟ್ ಎಲ್ಲ ಡಾಕ್ಟರ್ ವಿಜಯಕೃಷ್ಣ ಸರ್ಗೆ ಸೇರ್ಬೇಕು.
Okay, see now people who don't understand the language, for them we have given subtitles. And see, typically this is not a case of surgical intervention. They generally go to a dermatologist. But why I am showing you this case is, generally we give tuja, we give sulfur, and we give other remedies, and we miss the indicated remedy. I did the same mistake that you people made. I had given tuja, I had gave natramio sulfur. But this case was an eye-opener which told me, boss, stick on to the basics. So never divert from your basics. Okay. So here Laccan 200, a single dose, which made the magic, and you saw that. Now I'll share another simple case, a small case. Now this girl, you can see the image. I'll share the image so that, yeah. Now this is again a very simple case, and from what I'm trying to show you, the spot diagnosis, you all know, is a case of corn. Now this girl had corn which started almost 25 days back. She was taken to a local doctor who gave her corn cap. So corn cap was applied. Instead of things getting better, the things became worse. The swelling, the pain, the size, everything increased. And that's when the local GP there told, you please take her to a higher center, and she requires a surgical intervention. That corn has to be excised. Now this girl is one of our intern's younger sister. And when the father took an appointment, and when the father went to the higher center, this girl called the father, and she told, Dad, please don't get it excised. According to homeopathy, if this goes, then my sister will end up with something big and all. Please try homeopathy. And that's when this case came to our government college hospital, Bangalore, our OPD. Okay. So we took up this case. One of our PG doctors, she took the case in detail. So pain, complaining of pain, aggravation, pressure, touch, all common symptoms of a corn. Not able to walk. And in the past history, she had recurrent UTI. Okay. And appetite decrease, perspiration or palms and soles, grinding of teeth, and she also had bedwetting. Okay. So see, this girl, when she came to the OPD, the first thing that they saw was she used to mix with all interns, PGs. She used to mix very well, and she was very confident in answering the questions. The PG has taken, she is also listening to today's presentation. Very confidently, this 8-year-old girl gives her case. She alone gives her case. Okay. And in spite of she having pain, she can't sit in a place. She keeps moving around. Please listen to the case and mark your observation so that we can discuss once I finish reading the case for you. See now, sister, the homeopath intern, she doesn't like lizards and insects. So what this girl used to do now, she used to call her innocently, and she would tell, Didi, ek doubt hai, please mere ko ye bata do aap. And our homeopath, the young budding homeopath, would go to her. So this girl would purposely open up chapters which has pictures of insects, like for example lizard or any insect, and she would very cunningly tell her, Didi, thoda iske bare mein mere ko explanation de do na. Okay. And she would give a very cunning smile. When she was taken to the hospital for surgery, her sister had told her dad, please don't get it removed. But when they came back home, the scene was, this girl was on the father's lap, and they gave an impression to this homeopath that already surgery is over, and this younger sister was acting, ayo, mere ko dard hai, ye hai, wo hai. But nothing had happened. When the sister opened the shoe and she saw socks and saw, there was nothing. The corn was still there. But father and the younger daughter, they had an understanding. We will fool the, homeopath, and they had a prank. They had a prank with the sister. So these were a few basic things about the child. Very angry child, when told to do, goes away. Yeah, she gets angry and she goes away from the place. She wears dupatta and she enacts like a teacher. It happens daily after coming from school. This is what our homeopath friend, she gave us this history. She told she wears dupatta, she enacts like a teacher. Even with friends, she makes all of them sit. She becomes her favorite teacher and she starts acting like a teacher. Very conscious about how she looks. Likes dressing up very well. Very pampered child. Very mature for age. She is like mother. If mother is out now, for example, if mother goes to some neighbor's place or relative's place, she takes the role of the mother. She will become the mother. आपको ये चाहिए, आपको वो चाहिए, वो इधर है, ये उधर है. So she will become the mother there. Okay. So this is the case we got. Now again, the intention of sharing this case is, whenever we have a case of corn, we homeopaths, majority of us, even I used to do the same before joining Vijaykrishna sir, that we used to give, antimonium crudum, sulfur, ranunculus bulbosa, all those things. But in this case, how do you approach? What are your observations? So, there are few inputs which have already come. See, I don't want the medicine. See, let me make things very clear to you. See, I'm not looking at the remedy. See, remedy you will all get it later, but at least understand how to analyze the case, how to convert the patient's language into a rubric is the requirement of the day. Telling tarantula, telling lachesis, no, I'm not at least expecting the remedies now. We'll look at it a little later. So somebody says, mischievous child, yes, a precocious child. Yeah, she plays antics, yes, very good. Fancies, absorb, beautiful. Yeah, there are a lot of inputs coming up. I'm very happy with the inputs. Okay, now what you see in this case is, she is a girl who mixes very easily. Okay, she is an extroverted child and she gets into the character of a teacher, or she gets into the character of the mother. Fine. Now this is what we call it as fancies absorbed in. So there's a rubric, fancies absorbed in. Now what exactly you understand by fancies? For the beginners, seniors, kindly excuse. Now what do you understand by fancies? Fancies means imagination. Okay, imaginations which will be heightened. So here, two very important rubrics I took. One was fancies absorbed, and second very important symptom that comes up in this case is, she is a girl who is very, very mischievous. Okay, so two rubrics that we took, and fancies absorbed in and mischievous. I should have asked you now what remedies you want to think of. Okay, that extrovertedness, that cunningness, many would have thought of lachesis, many would have thought of phosphorus. But see the surprise here, when you repertorize, this is the beauty. The remedies that came up were fancies absorbed in and mischievous. She was a very restless girl with high energy. So I prescribed belladonna to start with. When belladonna was prescribed, this is what happened after 10-15 days, there was not much of a change. So then the rubrics were considered, and arnica, stramonium, cuprum and cannabis, 4 remedies come up. Now, which remedy do you want to prescribe? Now your job becomes very easy now. We have only 4 remedies. Okay. So which is the remedy that you want to prescribe? Many of you are for cannabis. Very good. I'm happy. Many of you are for cannabis. Good. Why not cuprum? Why not stramonium? Why not arnica? This is also a question that has to be answered. So why not arnica? Now arnica, for example, what happens in arnica? Basically arnica is a very angry constitution. When you talk to them, they are very angry. Avota, anger when obliged to answer. You have arnica there. And arnica is not a very extroverted person like this small girl. She used to mingle very easily. So I rule out arnica. And she used to walk around in arnica, touch aggravates pain. So that was missing. So arnica goes. The next remedy that comes up is stramonium, a very destructive remedy. Okay. Now what stramonium would fancy if she was stramonium? Stramonium is a very destructive remedy. A remedy with high energy. So even if they imagine any character, they generally imagine all these Avengers or any fast and destructive character is what they imagine. So I rule out stramonium there. Now cuprum. What exactly cuprum fancies about? There is a rubric in your repertory. Delusion general he is, meaning they feel they are very authoritative and they are general kind, very bossy, very dominating. It is a metal. Now this character in this particular girl was missing. She was not very stubborn, very obstinate. All those things were missing. And there we are left with a remedy, cannabis. Okay. Now many of the practitioners and others, I just want to give you a small clue. This is what I have observed in my clinic and I've learned from Vijaykrishna sir that cannabis almost will give you a picture like phosphorus. I repeat, when you have prescribed phosphorus and when phosphorus fails, please think of cannabis. Okay. After learning from sir, many of the cases we have got beautiful results with cannabis. Okay. Now again there will be a small doubt here: cannabis indica or cannabis sativa. Okay. Past history, this girl had urinary tract infection. So when there is a past history of urinary tract infection, the remedy will be cannabis sativa. This again is what I have learnt and from sir, and we have applied this, we have used it. See, when sir gives, he will apply and he will give it to us. So then we follow and we share it in the webinar so that it can help many of you. So we'll see what happened after a dose of cannabis was given. Now see the beauty. Cannabis was given on 10th. Cannabis sativa 1M was given on 10th. And 23rd, I'll show you the photograph. The size reduces. And one more area that you expect improvement will be in the bedwetting. So a girl who had primary enuresis stops bedwetting 13 days after a right homeopathic remedy. What else you want? Okay. So this was the original size, and after 13 days after cannabis, this is the size. Now you'll also see this. My young homeopathic friend, she was very happy. I thank her. She took the pains in taking all the pictures, and when I asked her permission, she was very happy. No sir, please go ahead. It's a learning process. Let everybody learn. Now, what I'm trying to tell you here is 13 days or 15 days, max 17 days, the corn beautifully disappears. Otherwise, this girl would have landed up in a surgical ward. Though it's a minor procedure, they would have removed it. With a right homeopathic medicine, we could help her recover. So that was a case of cannabis. Please be open and broad-minded. We never think of cannabis for corn. And I have also not prescribed cannabis for corn. I want to make it very clear. I have prescribed cannabis for a patient who is a cannabis patient basically. We are not treating her what? We are treating the patient. The corn or any pathology will be automatically taken care. Okay. One more last case related to skin. I'll again make this short so that we can spare time for the other interesting cases. Now this case I particularly wanted to share because this is a case of osteomyelitis. You don't have the audio here, don't worry, just understand. It's a case of osteomyelitis referred from a very good orthopedic surgeon. And this is a follow-up case. After our homeopathic remedy, the entire thing is trying to show you and explain you there. That area, it used to ooze a lot. Okay, so that oozing has stopped and it has become dry. This is what the son is trying to explain it to us. I'll just give you the background of the case. This man met with an accident. He was driving on a scooter. Some vehicle came and hit him and he met with an accident. And the entire toes had turned gangrenous. You can see if you have been amputated. I don't take the credit for that. It was all amputated when he came to me, and he was referred to me by an orthopedic surgeon for the osteomyelitis. And in allopathy, nothing much can be done. There's scrape, and again the possibility of it coming back is more. So very offensive discharge, is a non-diabetic and hypertensive, and is on allopathic treatment. See, he met with an accident few days back. Yeah, this is what I told you. Basically, very angry person. People at home are very afraid of him. Things should happen according to him. Not only at home, even outside, anywhere. He is a very angry person, and he starts blasting people. This was the small case. Though it was a very lengthy case, I'm just giving you the gist so that you understand. Now, what rubrics can you think of in this case? When you start thinking of the rubrics, I'll also, in the background, I'll try to tell you a few things that I've learned from Sir. Now, what was that? You have to understand here is the accident that happened and the body, how it reacted, going into gangrene and it had to be amputated. That shows the syphilitic tendency in this particular person. So when you give remedies or when you think of rubrics, we have to think of those rubrics which are highly syphilitic. Now, two rubrics that are taken, very good. Anger, contradiction from, absolutely right, and beautiful. One more PG of us, she gives you the pathological rubric also. Inflammation, bone osteomyelitis, good. So to keep things simple here, we have taken two simple rubrics. One is anger, contradiction from, and generals, inflammation, bones of bone marrow, osteomyelitis. That is the rubric we usually take. So two rubrics were taken, and we were left with three remedies: tuberculinum, murk, and silesia. Silesia, as you all know, is a very timid person, timid yet obstinate, but Silesia is not so outspoken with his anger. This constitution was more of a rebellious constitution, okay? And any stranger he can fight, any stranger he can get into an argument. Silesia will not do that. Nor he had that tubercular character. So what I did was Merksol 200. I did not give single dose. Let me be honest and accept here. Such deep pathology will not go in a single dose. I'll talk of posology in the end before I close the session. So Merksol 200 OD for 15 days was given. Daily, one dose he used to take, and you saw the improvement, everything being dried there. So osteomyelitis. That was related to skin. Now we will focus to another area. When you talk of the female genitalia, we get a lot of cases. Simple cases like fibroid, we get ovarian cyst, we get hemorrhagic cyst, we get polyp, we get prolapse, uterine prolapse, lot of cases. Though I have all those cases, I will just present you a very simple case of adenomyosis. I hope you are all getting what I'm trying to express here. Okay, so if you feel my speed or voice, if I have to slow down, you please feel free. Accordingly, I can continue with the presentation. Are you clear with whatever I've tried to express till now? Any questions? Should we take up questions? Everything fine, sir? No, yeah, no problem. Carry on. Chalo, good. When we get something like that, we'll also feel a little motivated. So we'll talk of fresh case, adenomyosis, a lady aged around 36 years, married for last 12 years, and she's got 2 kids. She had bad dysmenorrhea. She went to a gynecologist, and the gynecologist advised an ultrasound. Okay. Now, what happened in the ultrasound is, ultrasound, if you can just see this here, shows bulky uterus with features of adenomyosis. Okay, this is the diagnosis. Now, when a patient sees this diagnosis, or when the gynecologist explains to the patient that, see now there is, she's not a very educated female from a very low or a lower economical group. So she was explained by the gynecologist that there is a small katti, she's a Tamilian, and we have to remove your garbapai. The uterus has to be removed. Now, how this patient enters to the clinic, what is her reaction, all those things become very, very important. As a homeopath, you will have to concentrate on those finer aspects. Now, can you quickly give me some probable reactions of the patient when they come with reports like this? How do you think each of them can react? Somebody has already given me one reaction. Very good. They might come to you crying. They might become anxious. Beautiful. They might go into a panicky state. Good. Very good. They might be worried. Good. They might go into a state of indifference. Yeah. Very good. Sadness, hopelessness. Beautiful. I feel we should close the session. A lot of things. Good. So I'll just share a few things from my side. They can go into fear. They can go into panic. Sometimes they go into a state of inconsolable state, meaning you can't console them or you can't explain them. They go into an imaginary state. There is a rubric: inconsolable over fancied misfortune. They imagine, oh, this will happen, that will happen, and the remedy there is Veratramal. Okay, many of them feel unfortunate. Sir, why me? Yeah, why me? Okay, or they can go into a hopeless state. Fine, or they go into a state of resignation. They feel everything is over. I mean, they go into a state of resignation, like they go into a state of discontentment, and they give up. Like they resign, they give up. Or they can go into a state of being doomed. It's the end of world. Fine. So that is what we call it as doomed feeling. Or they might start pitying. Okay, how do they express to you, sir? You'll see this a little later. I'll explain pitying. Or they can go into a state of indiscretion. See, indiscretion, when you take in such patients, please be very careful. They are not educated like you. But what I mean by indiscretion here is, there are patients who will not know for what, how much importance should be given. There is a serious problem. They are not worried about the seriousness of the problem in spite of you explaining it to them. They might be worried about small things. Okay. For example, they might be worried about a small pimple on their face when they have got something deeper that they should worry about. In such patients, the discretion will be lost, and we take the rubric indiscretion. Or they might go into a state of indifference. Okay, it has happened, fine. So they go into a careless state, not caring about themselves. They go into an indifferent state. Or they might feel this could be a result of because I have done something wrong. or there can be a lot of delusions that can come up. So these are few common reactions. The reactions can be plenty. You can work on it. You can add your own reactions from your clinical experiences. So these are few reactions that we can expect from the patient. Now, how did this lady react? Okay. Now, this is the history where she had pain, almost like labor pain. She gets unbearable pains. She has to literally weep with pain. Married lady with 2 kids, but she can't control the pain. She literally starts weeping with pain. She had come to my wife, she's also a homeopath. So she had gone to her and, she went and she started weeping, crying. Madam, this is what the gynecologist has told. Fine, I am too young to suffer with all these problems. What will happen? I have 2 small kids, crying, blah, blah, blah. And she was going on and on. Okay. And what if I die? What if it turns out to be cancerous? That's what the gynecologist has told. It will turn into a cancer. Then if I die, my children will be pitied. I mean, my children will be orphaned. Okay. And what can all happen? And, continuously weeping and all. Fine. And from the time I got to know that I have this, I'm not eating, I'm feeling very sad for myself. I'm only 30 and why I should get all these problems at 30, etc., etc. And my wife, she's a very good listener. She heard to her all sorrows. She also explained to her in a very nice way what we can do in homeopathy and all that. She somehow got convinced, and she started taking more details about her. As a child, she's a very sensitive lady. Even if parents scold her or raise their voice in front of others, she would not like it. Very emotional. She can't see anybody suffering. For example, an orphan on the road, or a beggar, or any emotional scenes on TV, violent scenes on TV, she can't see. She generally likes watching comedy things. If at all she is forced to watch all those things, she starts weeping. Okay, very bad childhood. Father was an alcoholic, and mother did coolie, and then she brought her up with a lot of difficulty. Quarreling parents, and she regrets the fact why I was to be born in this particular family. And after marriage, husband is a very nice guy, and he takes very good care of her. So she's happy after marriage. Now she's worried about her adenomyosis, the fact that her uterus will be removed, and she starts weeping. Okay. Now I'll just give you the follow-up, and then you can give me your inputs about the case, and we'll have a small discussion, and we'll move further. So my wife spoke to her, as I told you, and the next cycle, she felt flow was pain was better. Flow comparatively was less. And April cycle also, she had pain. Only March cycle, pain was better. April cycle, she started with pain. And 2-3 months, she did not come back to us. August, again, she came back. Pains, the dysmenorrhea, there's absolutely no change. Now, why did she rescue us was she started fearing of cancer, and dysmenorrhea, she continues to take painkillers. That's when the case was retaken, and I have given you the case which was retaken. That was the case that we retook, and now you please give me your analysis. Beautiful. See, I'm really happy with your analysis. I feel yes, beautiful. Yeah, good. Happy. I'm happy that you are all in the right track. Okay. See, personally, I have not taken fear of cancer because, as I was trying to tell you, in that low economical group, for them, any small cutty is for them, any small growth, they have a feeling it is cancerous. Okay. So many of my colleagues, I can see the names, I feel very happy. Many of my colleagues have given a lot of inputs. Good. I'm happy even my second year, third year students, they are coming out with right things. It's a nice positive development. Good, keep it up. I'm happy. Now, see, I'll just give you the follow-up and then we'll look into the rubrics. So case was retaken and 23rd 8 2019, a single dose of remedy was given and she comes back to us on 10/10 2019. Last 2 months, pain was bearable, not used painkillers. So I told you please get an ultrasound done. So 7/12 she came back and she told, sir, things are much better, no pain, nothing. So I told get an ultrasound done. Now these were the few rubrics that I had taken. And the first sitting, my wife looking into the weeping thing, looking into that, wanting that reassurance, that weeping, crying and all, she had already given her pulsatilla. Okay. She was not a Stephisagria kind of she was not a kind of a sepia kind of a lady. Fine. We are left with Stephisagria and we are left with calcarea. Now, not a very esteemed kind of a lady, not a very diligent lady. If you just go back to her case history, she was not very much interested in studies. Okay. Though she regrets it later that, I did not study, I want my kids to study well. She was not very keen about studies. So for us, Stephisagria means a very diligent constitution. Wanting to study, willingness to study is Stephisagria. So that was not there. So a single dose of calcarea 200, calcarea carb 200 was given. And I hope you can see this. Normal study, ultrasound, abdomen and pelvis. Uterus and ovaries are normal. No focal bar fibroid seen. Now this is what a right homeopathic medicine can do. Okay. So these were the rubrics considered and remedy prescribed, and you have the results. Okay. So you listen to what she has got to tell.
என்ன ப்ராப்ளம் வந்தீங்க?
எங்களுக்கு கர்ப்பப்பையில கட்டி இருக்குன்னு சொல்லிட்டு வந்தோம். அப்ப எனக்கு பீரியட் டைம்ல ரொம்ப இடுப்பு வலி, வயிறு வலி எல்லாம் இருந்துச்சு. கட்டி நிறைய இருந்துச்சு. அது ரிமூவ் பண்ணணும், இல்லாட்டி கர்ப்பப்பையை ரிமூவ் பண்ணணும்னு சொல்லியிருந்தாங்க. நாங்க அங்க இங்கிலீஷ் மருந்துல பண்ணியிருந்தப்ப ஸ்கேன் பண்ணப்போ, அப்புறம் இங்க வந்தோம். நாங்க ரிமெல்லாம் எதுவும் பண்ண தேவையில்லை, கட்டி நாங்க கரைக்கிறோம், எங்ககிட்ட ட்ரீட்மெண்ட் எடுத்துட்டா சரியா போயிடுனாங்க. நாங்க எடுத்துட்டு இருந்தோம், 6 மாசம் ட்ரீட்மெண்ட் எடுத்தோம். அப்புறமா திரும்ப ஒரு ஸ்கேன் பண்ண சொல்லியிருந்தாங்க. திரும்ப பண்ணி பார்த்தோம், சுத்தமா கட்டி எல்லாம் ஃபுல் கரைஞ்சி போயிருந்தது. இப்போ எந்த ப்ராப்ளம் இல்லை, இப்போ நாங்கள் நல்லா இருக்கோம். அந்த இடுப்பு வலி எதுவும் இல்லை, வயிறு வலி எதுவும் இல்லை. இப்போ நான் நல்லா இருக்கேன், சரியா போயிடுச்சு.
So we'll move to the next case. This is again a case of bilateral uncomplicated inguinal hernia. Concentrate on the case so that we can have a healthy discussion. See, he was a 39 years old businessman who had pain in lower abdomen, and he consulted a surgeon, and they did a scan, and the scan showed inguinal hernia, and they wanted to do that surgical intervention, and that's when somebody referred him to me, and he came to me. So we took the case. Mild swelling on left on the inguinal region. On lifting or any exertion he does know, he has this swelling. So he's a businessman by profession. A lot of ups and downs in business. Married for last 8 years. Expects things according to him. If things doesn't happen according to him, he starts shouting. Business stress, business not going as per his expectation. Lot of debt, lot of credit he has taken. The anger and frustration he shows on his family members. This gentleman, I know him personally. He leads a very lavish life. club memberships, like experimenting with food. He can drive 100 to 120 kilometers. If somebody says breakfast is good in that particular area, or there is this soup, kal soup we call it as. In one area on Mysore Road, there is a hotel, it is good. So he drives to that place. He likes enjoying such kind of delicious delicacies, and he would drive back home. Okay. So he also had a lot of sleeplessness due to business stress. And one very important thing I observed was he was wearing a lot of jewelry. Okay. And as a small suggestion, I told him, boss, why don't you sell all this jewelry, clear your credit, at least you'll have a peace of mind and you can sleep well. You know what the answer he gave me was, sir, society identifies me. I am Mr. X, and when I am Mr. X, society has an image about me. They know that I have to wear all this jewelry. Like he's got a huge bracelet on his hand, lot of gold chains, etc., etc. Even if a single day, if I go without this, what will friends think about me? Okay, they might think that I am into some problem. For me, the jewelry adds to the position among my friends, among the society, and I can't let go all these jewelry things, is what he tried to tell me. Okay. Now this is the small case, though it was a very elaborate case. Now, quick inputs from your side. What do you understand? Yes, he is a angry constitution, very good. There's a lot of prestige in him. Yes, he is worried about what others will think about him. He is concerned about the society. Beautiful, very good. Yeah, good, Dr. Sujit. Government, beautiful rubric. Now, we'll also try to understand few rubrics so that you get a lot of things when we close the class. What is government? See, government means a person, who enjoys eating. He is a foodie and he likes all these delicacies, and he likes the best kind of a food, and he can go any kilometers, he can drive any kilometers to relish those things. When you get such kind of people, please think of the rubric government. We have some 10 remedies. Good, keep it up. Nice rubrics you thought of. Now, this is the scan. If you just go down here, you see that there is no sonological abnormalities. Fine. So, hernia, even an uncomplicated hernia, fine. See, if it is strangulated, it is very difficult to cure. If time permits, I'll share one failure case of mine, where the lady in front of me, she went into strangulation, she went into shock, BP came down, I could not get her pulse, we had to immediately rush her to a surgeon. Fine. Such cases are also possible. So we have to mark a line where we can help and where we can't help. Okay. So few rubrics that we take up here, we took up here. Anger contradiction from social position concerned about hernia inguinal. Okay. So the remedies: ignitia, lyco, nux, sepia, verat. Any wild guess? What was the remedy prescribed? Very good, absolutely right. See, like Naxvamika, he is not a guy who is angry even outside. I told you I know him very close. He has a very decent image with us, with our common friends. You can never see his anger. Anger is what is more expressed in home or in his office. Hard on inferiors, soft on superiors. That's a rubric. Your lycopodium, your platina, your verat, and you got lachesis. 4 remedies. Fine. So this guy who values more of gold, who is a big show off, my remedy was Veratramalb. And Veratramalb, single dose cured this particular case. And there was no need for surgical intervention. We have 20 more minutes. We'll try to make this a little quick. One more case of man with, we get a lot of rectal pathology cases. We get fissures, we get fistulas, we get perianal abscess, we get, hemorrhoids, fine. So this is a case of a man who had thrombosed prolapsed external piles, and he was advised surgery for that. He had bleeding and he had pain. And see, now I'll try to put it in a nutshell. I'm directly giving you the mentals. Okay, very shy natured. I'm up to myself. I don't open up. I don't mix with others. I talk less. I'm like that from before. If someone comes home, I just get into the room. I don't come and mix. I don't come and greet the relatives. Even in school and office, I'm like that. I don't voluntarily speak. There is some hesitation in me. When we probe further, what is that hesitation? Sir, I don't have confidence. And in office, I generally make sure I don't make any mistakes so that no one find fault with me. Okay. And one of his colleague, who is my patient, he had told him many times, why don't you go meet Dr. Vijay? He is very good with these cases. Without surgery, he can help you. Sir, I should have come to you before. If I would have come before, we could have avoided this situation. It is my fault. I did not come. I should have come. This is something he was going on and on. He was trying to tell me. And then I inquired, in which other situations you keep doing this? Is this the only situation or you keep doing this often? So he says, sir, I keep blaming myself. Any mistake I do, I keep blaming myself. Why did I do this? I shouldn't have done this. Many instances in the past it has happened, and I keep doing this. When I probe further, what exactly you mean by confidence less? When I asked him to tell more, sir, why you don't ask? What is that is holding you back? What is that hesitation you have? Sir, then he told, sir, what will people think about me? If I ask them, they will think this man does not even know this much. Okay. Has this happened anytime? Have people complained to you that have they told you don't even know this much? No. It has never happened. But I feel if I ask, what will they think about me? Okay. So this is the case. Now, what could be the probable rubrics? Very good. Yeah. Beautiful. Yes. So you have a lot of inputs. He's a very introverted guy. He's a very timid guy. Agreed. But the rubrics that we took here, because it is a thrombosed piles, okay, and we need something beyond timidity. So delusion insulted he is. Nobody has insulted him, but he feels, if I ask, what will they think about me? I don't even know this much. Fine. So delusion insulted he is. That self-blaming is more of reproaching himself. And I took a pathological rubric. I'll explain to you in the end. We don't take hemorrhoids. See, if you look into your repertory, prolapsed thrombosed piles, you have only one remedy, peonia. And I can't give peonia for this case. This case requires something bigger and something better than peonia. So these were the rubrics that came up. Sulfur, natriumur, ignitia, and axomica. He is outpatient, so I rule out nux, I rule out ignitia. Natriumur, sulfur, pulsatilla. These are the three remedies. In these three remedies, if I have to prescribe natriumur, I have shared in many of my previous webinars, natrum will have a strong aversion to sun, or strong aggravation from sun, which was missing in this case. So natrum also was ruled out. Left with two, pulsatilla and sulfur. If you read Vijaykar sir's book on introvert and extrovert, sir has beautifully told about pulsatilla. He has told pulse has introvertedness out of timidity. Okay. So the remedy, a single dose. Now this is the case of the first day when he came to me. We prescribed pulsatilla, and this is what happened subsequently after a week, after 15 days, and after 3 weeks. I don't have the latest photo because of the lockdown. We could not take the latest photo, but I spoke to him. He's much better. So thrombosed piles. A last case we'll take, then we'll have the questionnaire session, we'll have the take-home points. This case again, I'll be rushing through, keeping the time factor in mind. See, this is a case, few of you have seen this, vocal cord polyp. This case presented to me with very bad hoarseness of voice, almost like aphonia. We had to take case over paper. He had to write and give me the case. And this is how the case went on. He went to a very reputed ENT surgeon. And if you see the note sheet here, it says left vocal cord polyp and advised surgery. And below it is also told take cardiologist opinion for surgery. See, this case, everything was set. The cardiologist opinion was taken, everything was set, and he was about to get operated. He works for a college, he's a teacher by profession. The college dean, he told, I know Dr. Vijay, why don't you meet him once? So the dean himself brought this patient to me, and we discussed. I told him, boss, we will postpone surgery. Max, if you don't improve, go ahead for surgery. But if you improve, if I get the case right, what is the need for surgery? So on that mutual contract, on that mutual understanding, we took up this case. So he consulted an ENT surgeon. In the past, he had nasal polyp in his 8th standard. He was operated for that. Physical sensitivity, personal history, is a chilly patient. I'll skip all this. Very lengthy case. Okay. Looking into the life space, joint family, is more into sports, physically very strong. He was a national volleyball player. Does lot of human work, lot of social activities. Patriotism. He's made a huge flag of India. Okay, and 6 to 7 hours he teaches. In case if some student does not understanding his teaching, he takes special care for them. He takes special classes for them. He makes sure they understand what he is trying to tell. See, all this case taking happened in presence of the dean, who agreed with majority of the things that came up, and majority of the things even the dean had contributed in his case taking. He goes to old age home. He likes helping. Majority of the salary goes into helping. And when I asked him why, mind you, always asking why in the right areas are very important. Okay. So he said, I have got the best from the society and I want to give back to the society. He's a politician's son. The principal who had accompanied him confirms the symptom. See, I'm trying to tell you, he's a politician's son because a lot of politicians' kids will be into all these activities. But his activities and politics, he has kept it aside. He's not very active in the political front. He's more into all these things and never asked his students to vote for his party. He has never done such kind of things. He can't see blood. Can't see blood on TV. He has fainted many times. Okay. In spite of all this, he loves donating blood. But the only condition is he should not see blood while donating. Donation happens, fine. If he sees the blood, he again faints. Okay. So 20 to 25 times he has donated blood. He says donating blood gives me a beautiful feeling. He is basically a non-veg, but animal lover, does not like violence, so I stopped eating non-veg. Okay. So this was the case. The participants who have attended this case, please stop yourself from contributing. The others can contribute. Yes, I have few answers coming in. Is definitely benevolent, good, agreed. He's got fear of blood. See, fear of blood is a rubric. But what happens here? From the fear, he goes into fainting. So what you see here is, this gentleman, we gave a remedy. After 15 days, he comes back. 1 second. Yeah, we have the follow-up here. He beautifully improved after our homeopathic remedy. I'll share the remedy, I'll share the rubrics. Hoarseness is much, much better over a period of time. He starts taking classes. Okay. Now, what you see in this particular patient is there is a lot of passion. He's a very passionate guy. So the rubric I had taken was ardent. Ardent was the rubric I took. 3 more rubrics you see here that we had taken was, can somebody tell me what could be the other rubrics? Yes, benevolent you can take, fainting from blood, beautiful. Yes, good. You don't have patriotic as a rubric, I'm not very sure. I'll have to check the repertory, but from what I've taken, I took ardent, I took fainting at the sight of blood, that willingness to do good, willingness to help, that is benevolence. And I also took polyp. Now why polyp? 2 areas you see polyp. One is there is polyp in the vocal cord, and the other thing you saw in the past history that he had polyp for which he was operated. Okay. So I wrote a letter back to the gentleman, the ENT surgeon. Very nice ENT surgeon, very difficult to get such ENT surgeons. I wrote a letter to the ENT surgeon, respected sir, these were the reports, same ENT surgeon, I had referred him back. These were the reports, I have given him homeopathic medicines. Voice is very clear, he is able to talk, he is able to teach. Please do a laryngoscopy and give back your valuable opinion, is what I had written. To my shock, not shock means not about the treatment part, shock about the ENT surgeon, very professional, nice gentleman. He called back, very rare ENT surgeon calling you back, calling a homeopathic doctor, and he appreciated over the phone. The results are very beautiful. You can see on the note sheet, voice is clear, vocal cord is normal, okay, and polyp regressed completely. Very good improvement is what is written in the note sheet. And he also wrote back to me, which is very unusual in the present generation. Dear Dr. Vijaykrishna, congratulations, doctor. Excellent improvement. Usually this size of polyp, remember, it is the best ENT surgeon who writes back to us. This size of polyp will not regress with any medicines, including steroids, but now it is completely regressed. And he had called me and he had also told, any polyp, vocal cord polyp that I get in future, before I plan for surgery, I'll refer it to you. And he has kept up his word and he keeps referring vocal cord polyp cases. This is a small video where the patient shares his experience. Kindly listen to this.
Hi, good evening. Actually, my name is Dr Vijaykrishna. I work as a part-time faculty in Jyoti College, Nagarjuna and Kaveri College. I had a throat problem for past 4-5 months. I had a problem 4-5 months back. I had a problem, so I had visited to almost all the doctors and the best hospitals in Bengaluru. So every doctor where I went, they suggested one thing for me, that you have to undergo the silence and lot of prescription they gave. 100% I did follow whatever the prescription they said, and whatever they said me to follow and continue the medicine and all. Completely, I underwent with that medicine and all, but there was not even a slight improvement in my voice. I was finding so much of difficulty even to utter a word, utter a sentence. At last, Dr. Vijaykrishna, the doctor from Malaysia, he stands one among top 10 in the country. So he said very clearly for me that waiting for some more time will be no use. You have to undergo the surgery. So it's better that as early as possible if you go surgery, the impact will be very less. So he said me to go for a fitness test. So I underwent with the fitness test and all. And for the surgery date was also fixed. So mentally, physically, I was ready. So there was no hope for me to be undergo the silence for some more time, because almost 5 to 6 months I was in silence. I did not do anything, any work and all. So I was ready for the surgery. One of my teacher, he came to me and he suggested that anyway you are ready to go for a surgery. So I have a friend called as Dr. Vijaykrishna. You come over there for homeopathy medicine. You decide for my surgery, just go, come and try the medicine. He's very good doctor. He said for me, suggested for me. But I did not have any kind of hope, because English medicine only could not solve my problem from past 6-7 months. So what I thought, just because he being my faculty when I was in PUC and he's a principal in Nagarjuna College now, so he suggested me that to come. So I was not interested, simply just he said for me, just I came and I met the doctor. I was so happy, I was so glad. And doctor said me one thing, see, all the English doctors, they said for me, not.
At least, I don't know. Manish, can we continue for another 5 minutes? We have time, or?
Yes, sir, you can continue, sir.
Yeah, 5 more minutes, I'll just continue so that we can take up some questions. See, now what this case, the last case, was a case of vocal polyp. A single dose of phosphorus 200 did the trick. I have not repeated. Many of my assistants are attending this webinar. They know, they give the medicine, they take the case, so it's a very transparent thing. Phosphorus 200 single dose, and it made a huge impact. Okay. Now to conclude, there are a few more slides I would like to share here. See, the scope of homeopathy is abundant. That's what, when Dr. Hahnemann introduced or invented this beautiful science, he invented because he was not happy with allopathy. You all know that. So when you take up homeopathy, many students are there. You should feel proud that you have joined this beautiful science, divine science, as Vijaykrishna sir says. And sky is the limit. You can do wonders, but you should know the right homeopathy. That's very, very important. So the following points that I'll be sharing might help few of you unlock few things. Like, when you want to reach the simillimum, we don't have any shortcuts. When you're talking of a surgical case, we have the same pro forma. Okay. We take a proper case taking and we analyze the case. Analysis could be at the level of disease, very important. When I say disease, it is about the miasmatic analysis. Vijaykrishna's book on miasms is a very easy book, which scientifically has explained. You can go through that book for miasms. Analyzing the patient at the level of disease, at the level of the history is very, very important. Proper considering the proper rubrics, repertorizing, differentiating the remedies, and arriving at the simillimum. This is the common case pro forma one need to follow. Okay. And when you are taking a surgical case into consideration, make sure the pathology is covered. Now, what I mean, the pathology has to be covered. Like, for example, I was trying to tell you, when we treat a case of fissure, anal fissure, when we try a case of renal stone, or when we take up a case of fibroid, we at least make sure we don't enter the case, or we don't consider the pathology fibroid directly. We go take a broader rubric. We take uterine affections of, uterus affections of. So the remedy, make sure, also covers the pathology, which is very, very important. So these are a few examples I've given. If it is hemorrhoids, fissures, fistulas, You can take rectal complaints of any surgical complaints to do with liver area. You can take liver affections, kidney affections, heart. There's a beautiful case we had helped with Aurum, iode. That's also there in YouTube. I'll share you the link. You can. It's a surgical case, but I've not repeated it because it was already discussed. When you talk of posology, which is a very important point, see, I have classified according to the miasm. This is my understanding. I might be right, I might be wrong. Up to my whatever I have understood, I have tried to give you this. You can use it if you feel it is right. Now, what we do in our clinic is what I'm trying to share with you. When we have a typical psychotic case, which is surgical, for example, when you have a huge fibroid, we generally prescribe a low means I don't give 6x, 12x. It will be either 30 or it will be 200, which we give in repeated doses in psychotic cases. In psychosyphilitic cases, for example, that varicose ulcer case that I discussed with you, such cases we generally prescribe a single dose of an indicated remedy, or we repeat the same remedy if required in increasing potency. If it is frank syphilis, what I mean by frank syphilis here is, for example, you have gangrene. Here we generally give medium potencies in few doses, okay, few repeated doses. Yes, body requires few extra doses. See, if it is fast moving syphilis, for example, you have cancer, okay, for example, you have squamous cell carcinoma, okay. I have a case of squamous cell carcinoma, must be on a different platform. I'll discuss that. We have a case of gastric cancer and it is squamous cell carcinoma. Now this lady is with us for almost 1.5 months, doing very well. Okay, so here she is on RMRs. I repeat, RMRs. Please don't give RMRs for all cases of gastric cancer. This is some method Vijaykrishna sir has taught us. You need to go through a lot of drill, lot of modules to understand or to reach that level. Fine. But what I want to try to tell you here is, she is on RMRs and improving beautifully. Her HB was low, HB is improving. Vomiting was there, vomiting is reducing. And I meant here is, here we are giving repeated doses. So this is with the posology. Especially when you have big growths, a single dose will not be sufficient. You may have to repeat it because the vital force need to be stimulated and you'll have to prescribe or you'll have to repeat it very often. So we will take up the questions if at all you have any questions. And before we take up the questions, I would like to thank few people here. My teacher and my principal sir, Dr. Gurprasad sir, is very encouraging when we, the staff, when we want to do all these things, conducting webinars, etc. He's been very, very encouraging. Thank you for being there and encouraging us to take up such activities. One more gentleman, many of you might be familiar with this face. The principal of Alvas College, Praveen Ras sir. He had also called and I could not say no to him, a very young and dynamic man. I also take this opportunity to thank the management, Alvas management personally, and a lot of staff members whom I would like to thank. I can't take all the names, but the staff, teaching staff of Alvas, the management, the students who have attended in big number. I thank you all of you for joining here, and big thanks to the young and the student council. I don't know what position he has in the student council. Manish, for all the technical support, technical help. In big number, 500 was the capacity, and in 500 number, many of you have joined. I hope I could do justice in sharing what I know from my side. Thank you all for joining, and as I told, a lot of predictive faculty members, a lot of senior predictive doctors, senior doctors. Fine, I really don't know who are all there. I can't look into the list of participants, from bottom of my heart, I would like to thank you all for joining. I know 10:30, 9 to 10:30, patiently you were all listening. And I also would like to thank my family, the Nishika Clinic, the support. See, these things will not be possible with a dedicated young homeopaths. Okay, so I am fortunate. I have got a good young junior doctors. They take the case. They share their inputs. And before I take up the questions, thank you all for joining in. This is my mail ID and my phone number. We can keep in touch. Dr. Harsha, I would like to mention here, was very insistent that we have to start a YouTube channel, and he took pains in creating a YouTube channel for me. There's nothing right now, but you can subscribe. Probably from tomorrow onwards, we'll start posting in a lot of things, okay, on the YouTube channel. Fine. So we will take up questions. You can either unmute or you can type it in the chat box. I'll be very happy to take up the questions. And young, vibrant crowd. No questions? Yeah, if there are no questions, that's the best thing to happen. Okay, I mean, yeah, Dr. Sujit has a question. See, fancies, absorbed, and imitation. See, imitating, fancies basically is a psychosyphilitic rubric, okay? And when you talk of fancies absorbed, see, you take or you get into that role very seriously. Imitating can be because of various reasons. You want to put down somebody, it can be for fun, it can be for mischievous, it can be for mischief. It's a very superficial thing. But fancies is something that, where you have got into that character. See, not, for example, we'll take a practical example. Now, imitating as a teacher, fine, you just go there, imitate as a teacher, that's a different story. But you getting into the character, getting into the role of a teacher, you put that dupatta, you take the pains of looking like a teacher, and then you get into that character. Fine. So that will have more depth, and that is what fancies absorbed in. I hope it is clear. Now there is another question that was asked. Renal calculi. Thank you for this question, because yesterday Dr. Manohar, one of my very good friend, he was in Bangalore, he was at my place, and he was sharing a case of a 14 mm stone. If you want, I'll ask him to WhatsApp to Manish number and he will share it with you. 14 mm stone, which has come out. According to the anatomy, urethra maximum 6 mm is the thing. But 14 mm, beautifully, the stone has come out. So I personally feel if your remedy is right, you can do wonders. Okay. Case of fibroid in a menopausal woman who has no symptoms but has a family history of uterine cancer. See, anything that is silent, there are two things we'll have to be careful. Anything that is silent, we have two approaches here. One, it is silent, it is asymptomatic, leave it. And two, asymptomatic, silent can be dangerous. Okay. So in that case, please look into the case. If it is post-menopause, it should have physiologically regressed. If it has not regressed, then it means that she requires some medical help. So take the case properly and prescribe a right remedy. Okay. So Dr. Harsha says it is not 14 mm, it is 20 mm. Good. So 6 mm more. So 20 mm stone had come out very nicely. You see that stone, you will go crazy. When Dr. Manohar showed me the picture, I was crazy. Neatly it has come out. And I was also worried how nicely it can come. Otherwise they do lithotripsy and they charge in mm and it is very expensive. So right homeopathic remedy can do a lot of wonders. Okay. So any more questions? Anyway, thank you for your patient hearing, and Wish you all the best. Wish you all the success. Young homeopaths, fine. So practice the right homeopathy, divine science. Never give up. Don't practice other systems. So once again, I thank the Alva's management, the student council, and all of you for joining and for this opportunity. Thank you so much. Thanks, Manish.
Okay, sir. It was such an enlightening session, sir. Okay, sir. So if any further questions are there, sir, they can contact you through email ID, sir. Can they put?
Yeah, see, like, the only number I have just shared so that you can feel free to ask, and whatever I know, not necessary that I will be knowing everything, but whatever I know, keeping the time thing in mind, I'll definitely get back to you. Okay?
Okay, sir. So, sir,
Thank
if
you.
okay, sir. So if you permit now, sir, can we conclude the session?
Yeah, sure. Everybody will be eager to leave. Fine, it is 10:40 now.